The banners. Read them as marketing speak for the handwriting on the wall. How Hackensack University Medical Center in New Jersey and other hospitals around the United States see survival in the new world of the Affordable Care Act, President Obama's health care law.
When we started, we were an 800-bed hospital. Now we've acquired 2 additional community hospitals, and we also affiliated with 3 hospitals.
Robert Garrett is president and CEO of Hackensack University Health Network, which ramped up its expansion 2 years ago in response to the passage of the Affordable Care Act. So bigger will be the name of the game from now on?
I do believe so. There's almost a frenzy of mergers and acquisitions.
Why? Money. Under the new health care law, reimbursements for Medicare, which covers seniors, and for Medicaid, which covers the poor, are being slashed. So health care providers see consolidation as a way to cut the costs that eat up what they get. And see this form? It's a patient satisfaction survey. For Medicare patients, the more positive their response to it and the better their treatment outcomes, the bigger a hospital's reimbursement. Medicare covers 40% of Hackensack's patients, so tens of millions of dollars are at stake. Americans like the provision allowing children to stay on their parents' insurance until age 26, and the fact that insurance companies can no longer refuse coverage for pre-existing conditions or cap lifetime benefits. But cost containment, one of the goals of healthcare reform, is insignificant, according to respected health policy expert Robert Leshefsky.
We have a healthcare system that is bankrupting us. It is growing. The cost of healthcare in this country is growing at 3 times the rate our economy is growing, or the rate of inflation.
In just over a decade, the average annual medical cost for a family of 4 with insurance has more than doubled. That includes employer and employee premium payments as well as out-of-pocket costs.
This healthcare system's like the Titanic. It's sinking of its own weight. We can't afford this healthcare system any longer. And what the Democrats are doing is they're trying to load 30 more million people onto the Titanic.
If you're one of the 30 million Americans who don't yet have health insurance, starting in 2014, this law will offer you an array of quality, affordable private health insurance plans to choose from.
But more than half, an estimated 16 million of those people, won't be able to afford private insurance.
Every day we see 30 to 40% of our patients coming in without insurance. And this is not unusual, the case of community health centers around the country.
Ann Kaufman-Nolan heads Hudson River Healthcare, a group of 22 community health centers. This one in Peekskill, New York, serves 15,000 patients a year. It's already received $4.5 million in Affordable Care Act monies to expand.
And she sleeps 8 hours, I see.
The nation's 1,200 community health care centers were gearing up for the wave of new patients to be covered by the planned extension of Medicaid in the new law. Instead, whether they actually get coverage will likely depend on the outcome of the political battles taking shape in states that opposed Medicaid expansion, now that the Supreme Court has ruled they have the right to opt out.
The Supreme Court gave these Republican governors who wanted to get out from under the Affordable Care Act a put up or shut up moment.
Theirs to turn down what looks like nearly free money. The feds would pay for 100% of the Medicaid expansion for 3 years, 90% after that. It would be for the voters to pass judgment. And as for Republican candidate Mitt Romney,
what the court did not do on its last day in session, I will do on my first day if elected President of the United States. And that is, I will act to repeal Obamacare.
He, too, is asking the voters to pass judgment on President Obama's signature achievement.